As we reported yesterday, the National Health Service in the United Kingdom says that it will no longer prescribe puberty blockers for children. The NHS says there is not enough evidence to support the safety nor effectiveness of puberty blockers. The treatments now will only be available as part of research trials or in some private clinics. And joining us now from London, England, is Oli London, a UK citizen, detransitioner, and author of the book Gender Madness: One Man's Devastating Struggle with Woke Ideology and His Battle to Protect Children. Oli, good to see you, my friend. Your reaction to the NHS's decision and its pivot to more holistic type of treatment for children with gender dysphoria?
Well, this is a really landmark ruling because it sets the precedent for the rest of the world. We've seen Europe and the UK now following the science and finally waking up and realizing that the long-term data on puberty blockers suggests that it causes significant health concerns for children. There's not enough, long-term data that goes 10, 20 years down the line that tells you exactly what happens to these kids. But we do know that there is issue with bone density and bone development when these kids are starting hormones and puberty blockers age 13. This ruling will now ban any puberty blockers for under 18s, except in clinical trials. And we all know that kids cannot consent to these things, just like a kid can't get a tattoo or smoke a cigarette. This is a common sense approach. So I believe this will set the precedence for the rest of the world, and hopefully America will follow suit.
Yeah, we hope it will too. And you mentioned the other European countries, and we've talked about that before on this show, who've kind of reversed course when it comes to so-called gender affirming care. Why do you think that's not happening here in the United States right now?
Well, we've seen countries like Sweden and Finland, which were the initial pioneers in gender transitions on children in Europe. They have now reversed course because their long-term data is suggesting it's not healthy, it's not the right approach, and that they should instead be treating the mental health concerns of these kids. I think in the US, you have a for-profit system where doctors, medical insurance, there's a lot of money being made there. And, we're seeing kids as young as 11 in certain states being prescribed puberty blockers. In some places, they can just call up a clinic and get the puberty blocker prescription over the phone. So it's truly alarming. And I think in America, the medical industry is, of course, for profit. And there's a lot of money being made there.
Oli, what are you hearing over there in the UK about this decision by the NHS? What are people saying?
Well, it's a very positive reaction because, a lot of parents, kids campaigning groups have been fighting for this for a very long time. And the UK saw just a few years ago only 250 children being referred to the Tavistock Clinic, which is the gender transition clinic for kids. Only 250. That shot up to 5,000 kids being referred to the clinic in 2022. So I think people have seen that this is an alarming trend. It's not a naturally occurring phenomenon. Many of these kids are just doing it simply because it's become a social contagion. So I think people are awake. There's been some great responses from women's campaigners, from MPs in the UK. And you also have the former Prime Minister Liz Truss, who is introducing a bill to Parliament. She'll be speaking about it tomorrow, basically saying that all hormones, puberty blockers and medical transitions should be prohibited for minors under the age of 18. And it's a common sense approach.
It absolutely is. Oli, you obviously have your finger on the pulse of all this. What are you seeing right now? What are you following?
Well, I'm seeing more and more people speaking up. So in terms of the US, in terms of women's rights and protecting gender as biology, obviously we've just had the case in Mississippi. You also have 16 female athletes filing a lawsuit against the NCAA, which includes Riley Gaines, basically saying that, biological males shouldn't have the same access to women's spaces or women's sports. So we are seeing this pushback from many, many people. I think before people were afraid to speak up because, nobody really is transphobic these days. Most people are very inclusive and accepting, but I think people now are speaking up because at the end of the day, it's kids' lives are being ruined with these medical experiments. Women are losing their rights. So I think we're seeing a lot more people feeling the confidence to speak up, and that's how it should be.
Absolutely, and thank you, Oli, for speaking up as always. Great to have you on. God bless.
God bless. A pleasure. Thank you.